Hey everybody, my name is Ethen Ostroff and I am your future personal injury lawyer for your future personal injury case. Make sure to hit that subscribe button, follow along where I will make sure that your future personal injury case is protected. Today we are talking about a very dangerous drug on the market called Padcev. Padcev is used for certain kinds of cancer treatments, specifically for bladder, renal, pelvis, urethral cancers, and it is causing TENS, which is toxic epidermal necrolysis, and Stevens-Johnson syndrome. Horrible symptoms related to this specific issue that comes from taking this drug. You have a personal injury case, whether you know it or not. If you took this drug and you have either of those symptoms, and now Stevens-Johnson is so horrible, it feels like your body is burning from the inside. If you are dealing with symptoms like that, you definitely qualify for a personal injury case because this drug was just pulled from the shelves by the FDA in July of 2021. It was pulled because of these specific toxic parts to this drug that cause serious harm in people. This is a potentially huge lawsuit that's going to be coming. I'm going to be co-counseling and going to be helping with the beginning parts of this case. This is a huge potential case that has affected tons of people across the country. Now, a couple of the things that you should know about why it's okay to bring a case. You deserve to be warned about something like this. Drug manufacturers give people the ability to feel better when they take that drug, but they should have a reasonable expectation as to the downside. You were not warned about this. That is something that is not your fault. It is the drug manufacturer's fault for not warning people properly. They deserve to be punished for that. Now, there is a mass tort that is coming on this specific case type, and I would recommend getting at least an evaluation because it's totally free to get an evaluation about your particular situation. Now, what are some of the claims that make this a legitimate case? The first symptom of Padcev is a flu-like illness with a fever, fatigue, and nausea. Second, you might get a painful rash that can start anywhere and can spread quickly. Next, it can lead to blisters and inflammation inside of your mouth, nose, and your lungs. And then lastly, after a few days, the top layer of your skin peels off and will lead to lesions for 2 to 3 weeks. The top reasons to file a claim, since people are not aware of these risks, and they should be, you were put in a situation where a company put profits ahead of your safety. You will be justified to follow a claim because your body just had a toxic piece of medicine put inside of you without a warning. You should be pissed off about that. That's not okay. Last, if you are dealing with some other side effects, numbness or tingling, harm for an unborn baby, drug injuries such as various skin reactions, high blood sugar, severe drastic inflammation, nerve issues, certain eye problems, change in liver, skin rashes, decreases in white blood cells, hair loss, dry skin, increases in lipase or uric acid in the blood, diarrhea, itching, nausea, sodium. It is the right time to get your questions answered. If you are going through something, you deserve to get answers. If you have any questions, make sure to reach out. I am helping with this particular lawsuit. You can reach out directly to me and I'll get you connected with people that can get your questions answered. But before we get there, make sure to hit that subscribe button, follow along where I will make sure your future injury case is protected. Thank you.